Hello everybody, I'm Jake. I'm your ARP Neuro Therapy trainer, and in this video we're going to be going over the TMJ protocol using the PRS device. So with this particular protocol, we're going to be using the 2-pin lead system. So you just need the red one and the black one on the 2-pin lead system. Take your red lead and just place one of those sticky pads on your red lead, just like this. And you want to place the red lead on the right side of your cheek, just like that. Next, you want to take the black lead and place that sticky pad on the black lead, just like that. And then place the black sticky pad on the left side of your cheek. Now you just want to go ahead and fire this PRS up, so hold down that purple button until you hear the beep. Once you do, hit the plus button. It won't take long for you to start feeling sensation. So just turn it up to what you can tolerate. And then once you have that, you want to keep pressure on your cheeks, just like this. And then almost like you're yawning, you just want to open as wide as you can, and then close. Open, and then close. You want to keep movement on your jaw while these pads are on. Do 10 reps of opening and closing. And then once you complete those 10 reps, go ahead and turn this output power up again as much as you can tolerate. If you can't go any higher, that's fine. You just want to do 3 sets of 10 reps. Beware of compensations. If you cannot successfully open your mouth and control it as you're going down, then you want to turn down that output power. Make sure you can control it. Now it's going to be tingly, you're going to feel it around your jaw, you're going to feel it in your teeth. That's very common. You're supposed to feel that, and you're going to be activating muscles around here. So it's going to be weird at first, but believe it or not, as you go through movements on this, you're going to be able to tolerate more. After your 3 sets, you want to just proceed to this purple power button. Go ahead and power it off. Once you power it off, we're just going to switch sides. So black is going to now go on the right, and then the red is going to go on the left. And you'll repeat that process all over again, 3 sets of 10 reps as you power it up, opening and closing. You can even move the jaw around, 10 reps of opening and closing. Once you've completed both sides, you want to go ahead and hit main pulse suspend. And you should not feel it as much. Now, this is one of those cases where it's sensitive, so turn up that output power as much as you can tolerate on blood flow. As you go higher and you hold it here, you're still gonna feel light sensation, but at least when you have main pulse suspend on, it's a lot more tolerable to keep blood flow. If you feel yourself twitching too much and the contractions are too heavy, turn it down, because you can still get contractions on this sensitive area for blood flow. In total, you want to be on this TMJ protocol between 30 and 60 minutes. This is your TMJ protocol using the PRS device.